Right, y'all. Fireside chat with me, L'Oreal. And I got a very special guest. Not just a very special guest, but almost feels like family at this point. I know that y'all always talking about I got the bright smile. Cheese. I got some amazing teeth. And that is due to my dentist who is on the show today, Dr. Zerita Buchanan.
Yes. Thank you for having me.
Yes. And let me tell you, I'm so excited to have you on the show because this is something we've been talking about. First of all, you stepped outside too. You looking good. You're looking good this morning.
Thank you.
But this is something we've been talking about for quite a while. I wanted to make sure we got you on this platform, and there's numerous different reasons why. You being a Black dentist who has your own practice alongside a family, HBCU graduate. It's so many things that I want to touch on, but I'll just let you, how did you even get into dentistry?
So I grew up in a dental family. My father, grandfather, and great-grandfather are all dentists, and we're all all HBCU grads. So
That's so crazy.
Yeah, I learned at a very young age, but I always loved science. So it was natural to follow in the family legacy, but I didn't realize dentistry had such a profound impact on so many people because your smile really is your logo. People are very self-conscious about their smile. So loving science, but also loving building relationships with people, dentistry was a perfect fit.
Well, let me tell you something. People dread going to the dentist, right? So when they see you, I'm pretty sure it feels a little bit. You have the warm smile. You look like us. You're young like us.
Yeah.
So do you notice that you get like more younger people coming to you because they trust you?
I do. You know, there is a lot of data that supports patients prefer to go to someone from their community, right? Because we have a shared experience, bedside manner is different. So I do find that a lot of people prefer private practice, family practice, compared to, you know, larger environments where they may be one of a million.
Yeah.
And the doctor doesn't remember them. They don't see them every time. So building a relationship with my patient is very important. And a smaller private practice allows that opportunity.
And as I said, you work with family. So being alongside your dad, right? How is that? Because some people can't wait to get out the house. But you got out the house and went right into the office.
I got out the house and went right into the office. So I went to Spelman undergrad, moved to go to UNC Chapel Hill for dental school, and then came right back to Atlanta to start practicing. And, you know, family businesses, they are, you know, they come with some sacrifices.
Yeah.
But I love it. It's something very important about being able to help your parent. You know, because they helped you for so long, and then seeing where you can bring new ideas, technology, things that they probably didn't have access to.
Yeah.
So I enjoy it.
Now, when you come to work on somebody's mouth, are they trying to hit on you sometimes,
You know,
Dr.
we
Z?
keep it real professional. And you can't do a lot of talking while I'm working in your mouth, so it makes it easy.
Yeah, especially if they got a yuck mouth. They probably too embarrassed to try to talk to you anyway.
It's different personalities that come through the office.
Okay, so as far as with Listerine, do you think that this is something y'all going to keep a partnership or hopefully?
I hope so. So the donation has been really impactful because a lot of students, specifically students at HBCUs, they graduate with a lot of educational debt. And so Listerine is helping us give scholarships to these students. They're helping us send these students to different conferences so they can learn more about dentistry. It's all about exposure. So I really hope that the partnership will continue.
So who works on your mouth, though? Pause. Is that how? Yeah, that was a little, sorry, that was a little inappropriate. So, like, when it's time for you to get your cleaning and stuff, do you go to your father or do you go to another dentist?
I go to my dad.
I know that's
I've
right.
had all my dental work done with my dad. But, you know, Atlanta has a great collection of Black dentists here.
Yeah.
So I have friends from Spelman that I went to undergrad with, friends from Morehouse who all have offices in the area. So there is, you know, a lot of access to care here in the city.
Do they charge you?
I believe in paying people for their work.
What?
I
no,
do.
So even your father, though?
No, my dad. You know, I think I'm still in the hole with him from all the educational, payments he's made over the years. But I do believe in paying people for their work because I want people to pay me when I come.
I know that's right. So that makes sense. So, because some people, I've even heard some people say, "Oh, well, dentists are a scam or a ripoff," which I don't believe because I see the difference between when I was going to another dentist versus when I was coming to you.
Yeah.
I have a certain amount of cleanings now. I didn't have that many cleanings before.
Yeah.
And so I've heard people say, like, "Oh, well, now everybody gets a deep cleaning."
Right.
But the stuff that we're eating is pretty, like, damaging to our mouths.
And, you know, if we look historically at minority patients, our interactions with the healthcare system in America have been dismal. Like, a lot of people don't trust doctors. They don't trust dentists. So there have been gaps in people going to get care. And when you stop going on a regular basis, it becomes an investment. But I tell people, if you're going to invest in dental care, you need to have the proper home tools. So having a good toothbrush, floss, using mouthwash like Listerine. Because if you invest in dental care, you need to keep it up, right? You need to maintain it. So the earlier you start going, the more frequently, that's how you keep the bills down.
I'm so glad we get into this point, okay? Them big ass teeth, Dr. Z. I know you see a lot of people out here. The veneers is like the thing. And these people, some of them, it looks like they don't even need to get this work done, but they're getting it done because of the Hollywood smile. Okay, so what would you, like, what is the difference? What the hell? They don't know the size it's supposed to be? I know you see it.
I always recommend people go to a licensed dentist to get work done because we have access to certain materials, right? So porcelain is a great cosmetic material, and it's a lot thinner.
Okay.
The color match can be a lot closer to your natural smile.
Not that bright white blue.
Right. Okay. It's not that bright white blue. But also, when people get certain treatment done, if they're staining their teeth, you'll see it'll jump out at you, right? So I tell people, if you're going to use a certain mouthwash, use something like Listerine that doesn't stain the teeth. Make sure you go to Georgia Board of Dentistry to verify someone is a licensed dentist.
Okay, see, there we go. And then each state, you just use the state's name and say Board of Dentistry?
Yeah, and you can just type in the person's first and last name.
Because that's something that we need to know. There was a guy somewhere in Atlanta that was giving like reality stars these big fake teeth, and he ended up getting arrested behind it.
I don't know too much about his story, but every licensed dentist has to go through the Georgia Board of Dentistry. So if you look up their name, you'll see them, and then you can,
or the Florida State of Dentistry, or the New York State of Dentistry, every single state. So that's not just a one state thing. You should see a license, and it should be. Do they ask y'all to place the license somewhere else?
You do have to have your license placed in your office.
But when they got a big screen TV and you looking at that, that's what the problem is.
You got to do your due diligence as a patient and go online and kind of review people.
So the amount of followers have nothing to do with their license, correct? Because it seems like some people don't realize.
Correct.
Okay, so has anybody come to you to fix those? Okay, so say somebody comes to you with those ridiculously big teeth. Are they able to be fixed? Is that something that you can?
They are. Usually you will have to start over, so it's an investment. But they are.
What does start over mean?
You have to get a new set usually.
So file those down. Is it painful?
I don't even like to use that word in my office. We'll give you a lot of medicine so you're comfortable. Okay. But what I do tell people is when you do dental treatment, you have to remember that just putting a shield or a casing over a cavity can lead to greater health implications, right? So if you're going to someone who is not a licensed dentist, they may not be able to remove the decay. They might not be able to give you the proper instructions on oral hygiene. And you can get an infection that can get into your bloodstream and travel up to your brain. So it's nothing to play around with.
And one more thing about the veneers. I heard that there's something called veneer breath.
Yeah, there is. Because bulky material can trap food and bacteria if you can't floss in between it. I love this Listerine here because it helps with breath care. Honestly, I feel like the first thing people notice about you is how your breath smells and how your teeth look.
Yes.
So, and it's, for me, it really has psychological implications for people because they're embarrassed. If you ever see, people who cover their mouth when they smile, when they laugh, they're embarrassed of their teeth. So it's a sensitive subject, but there are things that you can do to improve your oral hygiene. Brushing twice a day, flossing once a day, using mouth rinse.
Okay, so we want more people to get into that because we don't want to smell your stank ass breath. Oh, no, that's me. That's just me. I'm speaking for myself. Okay. All right. So if they want to get involved in your program, because you said you also have a program. Yeah, a nonprofit.
So I did Increasing Diversity in Dentistry. It is a nonprofit, a 501c3 that helps to mentor underrepresented minorities who want to go into dentistry. So we were birthed out of Atlanta University Center, so Spelman, Morehouse, Clark, Atlanta, Morris Brown. But we now have over 1,000 students nationwide. So people can go to ididpipeline.org if they want to, get into the field. We're happy to accept new students.
And, as a dentist, you do make a good amount of money, right?
I try.
We want to make sure that we're encouraging people to do more occupations and have more careers other than being an influencer on Instagram, a podcaster, a rapper. Right. We want to show that there's people, like I said, that look like us that also are doing great things in the community, but also doing other jobs that we need. We need people that look like us to help us out when it comes to dentistry, health, any of those things.
Exactly. The documentary that Listerine created that Common narrates, it talks about some of the origins of dentistry in the Black community. In the rural South, Black patients were sent to the veterinarian to have extractions.
What?
Because there weren't any dentists who wanted to treat them. So that's why we're really doing the work that we're doing with I Did to create more dentists, to give access to care to marginalized communities that don't have representation.
Oh my God, we love that. And we want to thank you so much.
Thank you.
I know that there's a lot of people that want to come and find you, not just because, you're fine, but also because you're an amazing dentist.
Thank you. I appreciate it.
Okay, so where can they come find you? Where can they follow, support, buy the Listerine, all that good stuff?
So my office is Dental Dreams LLC. We're in the Stonecrest area, but they can follow me on Instagram. It's Zerita, Zerita B as in Buchanan, and they can request an appointment online.
There we go. Please make sure y'all go out and support, and make sure your breath is fresh and clean, because you're in people's faces, and that's important.
It is. Thank you.
Have you ever had to tell anybody that, though?
I do it discreetly.
How is that? Because that's something that we have a hard time with. Like, if there's somebody that's like, just not really fresh, what would your approach be?
So I'm always talking about Listerine, but also Listerine has little breath mints that you can pass discreetly. They have little tabs that are kind of like Listerine in a film paste. But you have to do it very discreetly because people are embarrassed by it.
Yeah. So you just say, well, maybe you might want to
try this. This is a new product, you know, that Listerine offers. Maybe you want to try that, and they'll get the hint that way.
So when somebody offers you gum or a little tab, it's because your breath stinks. Please take the kind information and run with it, right? Okay, perfect. Now we're going to do just a little general dental hygiene, I guess, tips, okay? So I've been hearing a lot about water picks. Do you recommend those?
So I recommend traditional string floss. Water picks are fine
I love floss.
as a supplement, but they do not replace traditional string floss.
And then, okay, one thing I learned from you, because this used to happen to me, what does it mean when your gums bleed a little bit when you floss?
It means you have inflammation. So if bacteria gets underneath the gums, it'll cause them to bleed. The more you brush, floss, use Listerine, the less bleeding you'll see.
Yeah, so I noticed that during cleanings where maybe in the beginning, I can understand what people were saying about it hurting a little bit. But when you build up your gums to be healthy enough, cleaning shouldn't even really hurt, right?
They shouldn't, no.
Yeah, they don't hurt me.
You should be getting your teeth cleaned every 3 to 6 months.
They don't hurt me ever. They don't hurt me ever. And but I understand what you mean, even when we were talking about being embarrassed, because I've had like a little pigment on my teeth. You know, that's something we dealt with. But like, because we got the whitening going on, it kind of balanced out for me, so I felt better about it.
Yes.
But I know a lot of people, when it comes to whitening their teeth, they don't really understand the process.
So there are a couple different ways to whiten your teeth, but the number one thing you need to remember if you're going to invest in whitening, things like red wine, tea stains more than coffee, tobacco, tomato-based foods, curries, turmeric, those things will stain your teeth right back.
Yeah.
And there are some mouth rinses that stain. I prefer Listerine because it doesn't. But once you stain your teeth, you need to go through the whitening process and then eliminate those things in your diet so you don't restain them.
Well, now that's starting to make sense to me why some of those really, really white teeth look blue, because they're probably using a blue mouthwash.
I don't know what.
It's so weird. You're like, I can't figure that one out.
It is strange. I think it's the materials that are being used as well.
And is there a certain age that you think people should do, like with the veneers? Because I did read somewhere, I don't know if this is true or not, but they said that people are getting veneers at too young of an age.
Yeah, so you do not want to do cosmetic dentistry at a young age. You want to be at least 18 years old because your skull hasn't fully developed, right? So you're still growing, your jaw is growing, and you never want to do anything if you still have baby teeth. So really, adults are the only people who are really eligible for cosmetic dentistry.
And would you ever put the gold grills in them?
So people have asked, and I've done it, if a patient wants a gold restoration.
Way.
Yeah, that is still, it's a fine material. But when we talk about grills, things like that, if you're not cleaning underneath, doing your brushing, your flossing, using Listerine, you will damage those teeth underneath, and then you might lose them.
Yeah. This is scary. I'm glad I take care of everything I'm supposed to. Thanks to Dr. Z. Thank you so much, Dr. Zerita Buchanan. Fireside Chats with Lo. We're gone.
We are the Morning Hustle.